Dr. Monty Klein here to talk to you about doctor-caused health problems. Now, I've been writing about this for over 25 years and I've mentioned it many times in my newsletters, but there's always new information coming out. Now, in July 26, 2000 issue of the Journal of the American Medical Association, Dr. Barbara Starfield of Johns Hopkins University noted that conventional medical treatment is the third leading cause of death in America. Now imagine that, the third leading cause of death. Now I just learned that Dr. Starfield, ironically, herself died in 2011 from reaction to the blood thinner Plavix taken in combination with aspirin. She was a victim of the doctor-caused disease that she so passionately addressed years ago. Now, every day, over 40,000 harmful, often lethal medical errors take place in the U.S., with medical errors of all types killing 440,000 per year, making it the third leading cause of death. Now, misdiagnosis occurs in all kinds of cases, and there are 30 million prescription errors every year. Now, I want to highlight a few of Dr. Joseph Mercola's 25 most shocking medical mistakes, which I linked in the newsletter article this month, so you can read the entire article if you want to, but also make some suggestions about how to protect yourself. Number one would be hospital-acquired infections. Now, I've written about this several times in the past, but the latest numbers, 75,000 people die each year in the U.S. from infections acquired in the hospital. The overuse of antibiotic drugs for the past 60 years is really the main cause of this, in that antibiotic-resistant organisms have been created. So first of all, don't take antibiotics unless you really need to take an antibiotic for a life-threatening health problem. Secondly, eat organic foods and meats to reduce your exposure to antibiotics in the food supply. That's really where we're getting most of our antibiotics. Then if you are in the hospital, require doctors and nurses to wash their hands and change their gloves before examining you. Okay, number two, unsafe radiation. Incorrectly calibrated CT scan instruments can expose you to unsafe radiation levels and, of course, result in cancer because radiation is a known carcinogen. So whenever possible, you want to avoid using CT scans in favor of ultrasound or MRI, which do not have radiation. Okay, number three, surgery on the wrong body part. Now, an estimated 7 patients every day have the wrong body part operated on. I know that seems incredible, but it's true. So before any surgery, make sure the doctor and the nursing staff know what is being operated on and that it is correctly marked. It should be physically marked on your body so that no error can occur in the operating room. Okay, then we have misdiagnosis. Now, there are studies indicating that people are misdiagnosed 10% of the time. I think it probably is more than 10% of the time, but at least one study says 10% of the time. So for anything significant, always get a second opinion. Never rely on just an initial diagnosis if it's anything, very involved at all. Number five, transplant dangers. Now, organ transplants, which were once pretty rare, have become a lot more common. The problem is the organ donor may have been carrying untold numbers of diseased pathogens that in turn are given to the organ recipient. Over 100 people actually in the U.S. have died from these toxic transplants. And about all you can do is closely monitor yourself if you have an organ transplant for any untoward symptoms that are happening afterward, and get immediate medical intervention if something doesn't seem right. How about patient mix-ups? Particularly if hospital patients have similar names to other patients. Mix-ups can occur where someone's given the wrong treatment. Fortunately, I've got an unusual name, so I don't have to worry about this too much. But, if your name is Jones or Smith or John or, what have you, that can be more of a problem. So before any procedure, be certain your name, your birthday, your wrist barcode are checked by the staff. Number 7, prescription drug mistakes. Now this is a big one. The National Patient Safety Foundation says there are 30 million prescription mistakes each year in the US. That's an awful lot of mistakes. So check any prescription drugs that you're getting to make sure your name is on the label and the drug looks correct if it's something you've taken before, that it doesn't look different than the last time you got it. Now, if this is a new drug you haven't taken before, so you're not familiar with what it looks like, look it up in a physician's desk reference book if you have one, or at the library, or probably online. You can get all of that information just searching the drug name and see a picture of what that tablet or that capsule looks like, and make sure it matches up. Okay, number 8, drug dosage mistakes. This is typically a problem where kids are involved, or kids are given adult dosages of drugs, which of course can be lethal in some cases. Now, study has shown that hospital staff stock the medication in the wrong place, shelved wrongly, a significant percentage of the time, 4% of the time, which of course that's enough if you happen to be in that 4% to cause a problem. Now that can lead, of course, to someone being given the wrong dosage if the drug was put in the wrong place on the shelf. Number 9, and this is kind of a weird one, but you hear about it on the news, fake doctors. You've heard about it on the news. Somebody claims to be a doctor, in some cases even a surgeon, but actually has never even been to medical school. So make sure your medical doctors are actually licensed by checking with your state authorities. You can do that online with the state licensure board. And there's also a website called certificationmatters.org, certificationmatters.org, just as a double check. I know this doesn't happen very much, but if you're the one it happens to, it's a pretty significant problem. And the last one I'll give here is baby abductions. This is a really scary one for parents. Since 1983, 132 newborn babies have been abducted from U.S. hospitals. So make sure a parent or a nurse is present with the baby, the newborn baby, all the time in the hospital. Better yet, if possible, have a home birth with a midwife and you won't have to worry about this one. Now, for years, we've been told to drive defensively. I have a new motto: live defensively. In the world we live in, particularly as it relates to conventional medicine, we need to be wary, to be suspicious until proven otherwise. Living defensively can save your life. Now, I hope this information helps you in your pursuit of better health. Thanks for watching.